We've all been there, right? That knot in your stomach before a big meeting, or that racing heart when you're running late. We talk about anxiety like it's all in our heads, but our bodies feel it in a big way. Today we're going to get into exactly why that is.
So that's the big question, isn't it? Why does something that starts as a worry feel so incredibly physical? It's a super fascinating connection, and by the end of this, you'll see the whole picture much more clearly. Let's dive in.
Okay, so first things first. If you've ever felt like your body was completely betraying you during a moment of anxiety, I'm here to tell you, you are not alone, and it is definitely not all in your head. These feelings are real, they're physical, and they're a totally normal part of what anxiety is. I mean, just look at this list. Does any of this sound familiar? That feeling of your heart pounding so hard you can hear it. The shaky hands you just can't seem to control, or that sudden wave of nausea that comes out of absolutely nowhere. Nope, not your imagination. These are legit physical reactions that tons of people experience.
All right, so why? What is actually going on inside of us that causes all this chaos? Well, it all boils down to this brilliant and very, very old survival mechanism. Think of it as your body's own personal alarm system.
And the name of the game here is the fight or flight response. This is your body's ancient automatic emergency response system. When your brain senses danger, it instantly gets you ready to either stand your ground and fight or get the heck out of there as fast as you can.
And here's how that chain reaction works. It's lightning fast. First, your brain perceives some kind of threat. Immediately, it hits the panic button and floods your system with adrenaline. That makes your heart beat faster and your breathing quicken, pumping oxygen to your muscles. And just like that, in seconds, your body is primed for action.
Now, here's the crucial part. This whole system is fantastic if you're, actually face-to-face with a tiger. But with anxiety, that powerful alarm can get triggered even when the danger isn't real. It's a perceived threat. So your body is reacting as if the tiger is in the room, when really, it's just a stressful thought in your mind. And that false alarm can show up in a couple of different ways. You've probably heard the terms anxiety attack and panic attack, and they get confused all the time. The easiest way to think about it is this. An anxiety attack is like a slow burn. It builds up over time, maybe tied to a specific worry. A panic attack, that's a lightning strike. It's sudden, totally overwhelming, and can hit you out of the blue, peaking really quickly. So what happens when that internal alarm system basically gets stuck in the on position? Well, that's when we start to move from just occasional worry into the territory of a chronic condition, or an anxiety disorder.
And we're not just talking about one single thing here. As you can see, anxiety disorders are a whole family of conditions. They range from the constant, free-floating worry of GAD to the intense situational fear of a phobia. But that underlying physical fight-or-flight response, that's a common thread that runs through so many of them. And just to give you a sense of how common this all is, we're talking about roughly 1 in 5 adults. That is a huge number. And the data also shows that these disorders are diagnosed more frequently in females than in males. But here's the really important part, the good news. All of this, the physical symptoms, the anxiety that's driving them, it is manageable. There is a clear path to getting back a sense of control over your body's responses.
First things first, though. The absolute most important first step is to talk to a doctor. Why? Because symptoms like a racing heart or feeling breathless can sometimes be caused by other physical issues, like an overactive thyroid. So you've got to rule those things out first to make sure you're treating the right problem. Once other causes are ruled out and anxiety is confirmed, treatment is actually super effective. It usually centers on 2 main strategies that work really well together. First up, you've got psychotherapy. One of the most common types is cognitive behavioral therapy, or CBT. That basically helps you learn to recognize and challenge the thought patterns that are kicking off the anxiety. Then there's something called exposure therapy, where you slowly and safely face your fears, which retrains your brain to realize you can handle it. Medication can also be a real game changer. Things like SSRIs are often used as a long-term approach to help rebalance brain chemistry. For more immediate, short-term relief, you have benzodiazepines. And if the physical symptoms are the worst part for you, beta blockers can be amazing because they directly target things like a racing heart, bringing some welcome physical relief.
So when you step back and you look at the whole picture, what does the future really look like for someone dealing with all this? Well, I'm happy to say the outlook is genuinely hopeful. And this quote really just says it all. The right approaches can help people effectively manage their symptoms and seriously improve their quality of life. Relief isn't just some far-off possibility.
It's a very real and very common result of getting help. Which kind of leaves us with one last question. All those physical feelings, they're your body's way of talking to you. It's an alarm bell. So the real question is, what's the first step you can take to start listening to what it's trying to tell you?